You can get Lyme and other tick-borne illnesses at any age, but experts say the diseases spread by deer ticks pose a greater risk for children and older people.
Seniors, especially those with compromised immune systems, are being urged to take precautions as some doctors report an increase in tick-related infections in people over 65 so far this year. News Center Maine's Vivian Lee reports from Yarmouth.
In April, Sue Bott's granddaughter found a young deer tick known as a nymph embedded in her back.
And it was like a pin prick, that tiny. And it left a very small red spot.
Sue immediately went to a quick care clinic. She didn't have any symptoms of Lyme, like a bullseye rash. A blood test also turned up negative for the disease. But then the grandmother started having fevers on and off.
Irregular heartbeat and high blood pressure, and hard time breathing.
She started to have more severe symptoms that landed her at Maine Medical Center. Doctors ran a full panel of tick-borne diseases. Sue tested positive for a common tick-borne infection known as anaplasmosis. Complications from the disease, including respiratory issues, can be life-threatening in older patients.
Chronic medical conditions can be aggravated or made worse by the Lyme disease or the other tick-borne illnesses.
Dr. Scott Patch is a family physician at Intermed, where Sue is also a patient.
Hi, Sue.
Hi, Dr. Patch. How are you?
Good. How are you?
Dr. Patch is seeing a spike in Lyme and tick-borne illness cases in patients 65 and older. He says if you find an embedded tick, you should reach out to your doctor, especially if you have flu-like symptoms. But unlike Lyme, with anaplasmosis and babesiosis, a bullseye rash is not common.
That sort of recurrent fever, achiness, no rash, you're kind of like, oh, is this COVID, is it flu? This time of year, those are less likely, so we definitely are thinking anaplasmosis, babesiosis.
Sue was treated with antibiotics and has made a full recovery. Every time she goes outside, she wears protective clothing, does frequent tick checks, and takes a shower after coming inside. Experts recommend following these precautions to stay safe. In Yarmouth, Vivian Lee, News Center, Maine.
By the way, the CDC recommends a two-tiered blood test for Lyme disease, but not for other tick-borne infections. But doctors say patients can advocate for additional testing.